Dry needling is quickly becoming a buzzword within the sports medicine field. It offers quick recovery times for muscle strains and sprains, improves joint range of motion, and can even improve sports performance. With its growing popularity, there is some concern over who is qualified to perform this procedure. According to the American Academy of Physical Medicine and Rehabilitation, dry needling is an invasive procedure and adverse effects may include bruising, collapsed lungs, nerve injury, vascular injury, or infection. The instrument used in dry needling can exceed 4 inches in length. They are sterile, solid, filiform needles that are regulated by the FDA as acupuncture needles. Many chiropractors and physical therapists object to this labeling, claiming that one profession cannot have exclusive rights to a tool or instrument. They use the argument, just because you use a calculator, that doesn't mean you're an accountant. True, but due to the inherent risk of puncturing the skin several inches and the possible adverse events, the FDA has determined that, quote, sale must be clearly restricted to qualified practitioners of acupuncture as determined by the states, unquote. Physical therapists and chiropractors maintain that their education in anatomy and physiology and clinical experience working on the surface of the skin is enough to qualify them for this procedure of puncturing the skin. So let's take a look. Acupuncturists are required to have a minimum of over 700 classroom hours and 660 supervised clinical hours in the training of acupuncture. That does not include all the additional required education and testing in anatomy and physiology, biochemistry, and clinical science classes. Most dry needling courses for chiropractors and physical therapists are held over a weekend, some as little as 10 hours long. Does all that extra training make a difference? On June 21, 2006, former judo Olympian Kim Ribble-Orr suffered a collapsed lung from a non-acupuncturist doing dry needling, and she says, "It just ruined my life." In December 2013, Torrin Yater-Wallace suffered a collapsed lung from a physical therapist performing dry needling in Colorado while he was preparing to compete in the Sochi Olympics. Mitch Clark is a professional mixed martial arts fighter that had to have an acupuncture needle surgically removed from his arm and miss a fight after a needle broke when a non-acupuncturist was performing his needling. It is because of these and countless other stories that the American Medical Association and American Academy of Physical Medicine and Rehabilitation have both come out with statements stating, quote, dry needling should only be performed by practitioners with standard training and familiarity with routine use of needles in their practice, such as licensed medical physicians and licensed acupuncturists, unquote. It is true that there are many physical therapists and chiropractors that have performed dry needling without incident, but when it comes to your health, is it really worth the risk?